Hello dear friends, my name is Dr. Igor Atabekov. I'm clinical oncologist practicing since 2010. Today we are continuing our video series on metabolic and mitochondrial theory of cancer and the alternative approach to cancer treatment, or I would say adjunctive approach. And as I promised you, I will show you some cases of successful or not very successful usage of these methods in struggle with cancer. Let's get started. So, dear friends, again, if you did not see previous videos, please watch them, otherwise you won't understand anything, because I won't tell you again and explain you again the same things that I explained before in previous series. And again, this is press pulse therapy article. In general, we use the press, chronic stress for tumor, for example, carbs limitation, the tumor will be starving, and then we use these pulses to hit the tumor and get additional stress. Otherwise, tumor will survive because it's a highly surviving organism inside the human body. Here they also said that they did experiment using keto diet with hyperbaric oxygen. I told about it in previous videos if you don't understand what I'm talking about, plus supplementation of ketone bodies on animals. It really increased the life expectancy of these animals. They survived longer. The tumor was not growing so fast, not so much metastasis, so many metastases. And they did other experiments. They took, some mice were taking high carb diet, the others low carb diet, then third group ketone supplementation, fourth group hyperbaric oxygenation, and fifth group all together. And they found out that all the animals were living longer if they did not take high sugar, and the fifth group was the best one. That's why, of course, it's logical to check, maybe it will help in patients, in humans with cancers. But I will tell you one more recent story about the dog that was diagnosed with the mast cell tumor. The host of this 7-year-old pit bull terrier, in 2011 they found this tumor. He rejected the standard protocol of oncological treatment. They switched the diet from the dog's food to raw vegetables with fish. It did not help, the tumor was growing. Then they decided to use calorie-restricted keto diet. And the tumor, just within several months, it totally disappeared, you can see here. And the dog was living for, you can see here, until 2019, until the age of 15 years, and died of enlarged heart, not of the tumor. Again, very important. The tumors, they use fermentation instead of oxidative phosphorylation. Instead of using oxygen to produce a lot of energy from one sugar, they use no oxygen and produce very few energy from sugar. And they produce the waste products like lactic acid, glutamic acid, and succinate. Succinate, I was talking about it in previous videos. It helps the cells to survive, helps with hypoxia. But here you can see that it may also help tumor. All these acids, they acidify the microenvironment around the tumor, and it helps it to survive, to be resistant to immunity, resistant to our chemotherapy, radiation therapy. Also, all our therapies helps to also acidify microenvironment even more, and the tumor survival will be increased. But if we restrict glutamine and glucose and have high ketones that are anti-inflammatory, that help to restore the mitochondrial function and restore pH balance, it may theoretically help to struggle these tumors, and it's a non-toxic therapeutic strategy. This is hypothesis. Now let's talk about the patients. This is the 54-year-old man with lung cancer who had some courses of chemotherapy, radiation therapy. He had metastasis in his brain. To be honest, patients with brain metastasis they don't usually survive long. It can be just several months, maybe half a year, maybe 1 year, but it's not a long life expectancy. And after this treatment, he initiated keto diet in order to try to stabilize this tumor. You can see here a lot of ugly shaped, uneven borders. These are metastases, they're big. And here you can see after nine years, you can see only what is remaining from these metastases. And here you can see the tumor. Here's the tumor. It's 2007 in the lung. Lung must be black. This is the tumor, white thing. And here you can see no tumor. Here you can see some fibrosis. This is after 9 years. But this mitochondrial metabolic approach can be theoretically used not only in lung cancer. For example, this is breast cancer. This article discusses how it can help in breast cancer to reduce systemic inflammation, for example, and no causing damage to normal cells. This is their randomized controlled clinical trials on a breast cancer patient. I showed it in previous video, but again, it helped breast cancer patients who were undergoing chemotherapy before surgery to shrink the tumor to easier remove it. And who was on keto diet, you can see they have smaller tumors after chemotherapy. Chemotherapy worked better. 27 millimeters against 6 millimeters. The thing is, there were no significant differences in patients with metastatic disease. I think that is just my thoughts, my theory, that when the tumor starts, it's usually not super developed. It must undergo evolution. I told you about it. It will become worse and worse and worse during its lifetime and more resistant. And when the tumor learns to metastasize, it's usually already more aggressive. That's why most likely I think that keto diet only cannot help with those tumors. You need more things to do to fight with it. That is just my theory. I am not saying that it's truth of the universe. This is the patient, 47-year-old. She had a highly metastatic disease from the very beginning in 2016, but she refused any treatment. She thought, okay, chemotherapy is too toxic and I don't want to do it. And she was brought to the hospital again in few years because the tumor grew too much. She was feeling so bad, a lot of symptoms. Metastases were everywhere, in brain, in bones, in liver, in abdominal cavity, in belly, in lymph nodes. She had a lot of respiratory problems with her lungs. She could not already walk, was very weak. And the doctor said, okay, sorry, we cannot do chemotherapy anymore because it's poisonous and it just you won't survive it. And she was already 38 kilo. And you can see here that she received the 6 months treatment protocol, which is this metabolic treatment plus keto diet plus hyperthermia, local heating up, plus hyperbaric chamber, and all the lesions were eliminated. You see how many metastases were in the beginning, right? And this is later. And in 2017 or in 2021, she has no symptoms and no signs of the disease. This is really incredible. One more case on the brain tumor, glioblastoma. Usually, very few people, even with all the treatment possible, survive more than 2 years. This is highly aggressive and very resistant tumor. Even surgeons remove it, it still grows because it grows with spreading. You cannot see where the small cells that are growing to their surrounding tissues, and you cannot cut out half of brain because it will kill the patient, of course. That's why these tumors, they are very resistant to radiation therapy, to chemotherapy. That's why, unfortunately, this diagnosis is not very effectively treated by official medicine. But this patient refused. He is a young man, 32-year-old man. In 2014, he had first symptoms. He refused the standard care. He refused dexamethasone steroids because we usually use steroids to decrease edema around the tumor so it doesn't push too much the surrounding tissues and cause too many symptoms. but it has problems like increasing sugar, like decreasing the immunity, and he was using just keto diet. This is Keto Mojo, it's not an advertisement, I'm just telling you that there is a device that not only measures sugar but also ketone bodies, and in usual person who eats carbs, this ratio between sugar and ketone bodies is like 60 to 1 maybe. That means sugar is 60 times more than ketone bodies, and in him it was 2 to 1. That means he doesn't eat a lot of sugar, he does keto, by the way, and the ratio is almost like 2 to 1, right? 2 sugar to 1 ketone body, and a lot of ketone bodies. That's why. This is considered a very good therapeutic level for cancers, according to Dr. Thomas Seyfried. And what is interesting, looks like ketone bodies, they help to decrease this edema without any dexamethasone. That is very good because dexamethasone has bad adverse reactions. Then tumor was growing slowly, and the patient underwent surgery, and then still the tumor is growing slowly, but he's doing keto diet, and he has active life, got married, he has 2 beautiful kids. That's why this situation is very unique, to be honest. Here you can see his MRIs. One more case of glioblastoma, brain tumor, 65-year-old woman. She was having memory loss, chronic headache, nausea. They tried to remove the tumor, but again, incompletely. Before standard therapy, she did some fasting, then restricted keto diet, used some vitamins, minerals, did not use dexamethasone. After the surgery, even the tumor was not removed totally. First, there was no tumor visible. Then, after 10 weeks, they saw some evidence of tumor. It would be interesting how it was developing later, but I don't have any update, unfortunately. But still, there was no edema. It's interesting. You can see here her MRIs. Keto diet was well tolerated. I think it would be nice to add other things, to do pulses on the tumor, according to press pulse theory. Just keto diet may be not enough. One more case, 38-year-old man, again headache, nausea, vomiting, some seizures, some weakness. He had elevated insulin, that's very important. Again, insulin promotes tumors to grow. There was a surgical removal, again, not totally they removed it. He was fasting before surgery and was taking vitamins, minerals. Also, he was taking some other adjunctive remedies that have a potential anti-tumor effect, but not yet included into the anti-tumor protocols because they don't have enough clinical data. Chloroquine, for example, anti-malarial drug that helps to block lysosomes. I was talking about it in previous video where I was telling you about cannibalism, how tumor survives in total food restriction. And after 9 months, he of course lost some weight on keto diet, but all his symptoms resolved and he was in good health without any evidence of tumor. Let's wish this person to stay healthy. This is his tumor before surgery, and this is the metabolism of this tumor. You can see blue shows how active tumor is. Metabolically, is it consuming food? Is it producing any energy? How active it is and how alive it is. And it's declining, you can see. Red one shows the neuronal cells integrity, meaning there is some restoration of neural cells, normal neurons. And this arrow shows the angle. The more angle, the worse, because high angles are considered to be connected to malignant tumors or to necrosis after the radiation therapy. And here you can see how the central structures were displaced because of the tumor, because of the edema swelling around, and this red line shows the displacement. And during this therapy you can see how it's going better, and here it's already in the middle, no displaced anymore. Edema is gone, the tumor is not pushing anymore. There were more studies, on children, for example, with some good results, increasing survival, increasing life expectancy, decreasing the symptoms. I mean the bad tumors when they cannot be totally removed, for example. In general, all these clinical trials, they show that this metabolic approach can help to increase survival. It can help to make conventional treatments like chemotherapy, radiation therapy more effective. But again, usually they used just the keto diet, for example, and as for me, that's not enough. Better to use combinations to increase its effectiveness. What is very important, sometimes you can hear stories that person started keto diet and his tumor grew and progressed and looks like keto diet was very bad for him. Really, there are some tumors which have active enzymes. These enzymes that I marked here, highlighted here, usually most of tumors have these enzymes low, and these enzymes are needed to metabolize ketone bodies. If it's low in tumor, that means this tumor cannot use ketone bodies and keto diet will work well. If they are high, it's not often, but some tumors have high enzymes. That means if we produce ketone bodies, the tumor will eat them and will thrive. So yes, not all the tumors are the same, and we cannot use the same approach to everyone. That's why our goal of our medicine and science to make these tests for these enzymes regular for all the patients. One more interesting clinical trial, 50 patients, they compared combination of radiotherapy plus usual diet and combination of radiotherapy plus keto diet. And they found out that keto diet, calorie restricted, was more effective in prolonging life and increasing the results of treatment of those patients. Again, this supports what I said before, that really this can help in combination. Very interesting article on patients with pancreatic cancer. Pancreatic cancer is very highly resistant to chemotherapy. Not many patients come on first or second stage when it can be removed, but even after removal, it often comes back, very often comes back. And here they took the 33 patients who had already metastatic disease or tumor was too big and it cannot be removed. That's why for those patients only chemotherapy is the option, and unfortunately chemotherapy never heals those patients. They had just 3 months of usual chemotherapy, and it was combined with insulin. It's called insulin potentiated chemotherapy. And of course some patients they died, but as they also say that it happened because of cirrhosis or embolism or adverse reactions of chemotherapy because, for example, immunity fell down too much and infection developed, but not from the tumor. And as you see here, 54% of patients had a total disappearance of the tumor and are healthy, alive, and free from disease progression. That is really incredible. Usually it will be 0% or, I don't know, very small, less than 1%, I guess, because chemotherapy doesn't heal, doesn't cure those patients. Here also 24 patients with advanced gastric stomach cancer, which cannot be already removed, only chemotherapy. Chemotherapy is not working very well with gastric cancer, with stomach cancer, unfortunately. And as you see here, they was using keto diet, hyperthermia, that is heating up locally the tumor, oxygen chamber, metabolically supported chemotherapy, and they found out that 88% had total disappearance of tumors. I really cannot believe that. I don't know if it's real or for me as a oncologist, what I see usually on patients, to be honest, if the patient is getting chemotherapy with stomach cancer, just prolonging life, not disappearance of tumor, very rarely. One more case. The last one for today. I know I'm tired already, you're tired already of listening to the doctor. So this woman, you can see a very big tumor called thymoma. She had the symptoms of myasthenia gravis. It's a weakness that is increasing more and more, starting from morning to the evening. That cannot be already surgically removed. She had also 7-day fasting, fluid only, once in 1 to 2 months. She got keto diet, and after 2 years, her tumor totally disappeared. What is interesting, it was happening by, by like attacks. First it disappeared 32%, and she got a relapse attack of the symptoms. And then the second attack, and she got a total disappearance. Looks like its immune system was activated and attacking and again attacking. So it's very interesting cause of tumor disappearance. And 3 years already, she's free of this tumor. She lives normal active life, and I hope it will stay like that. Again, look, no chemotherapy, nothing, no radiation therapy, nothing, just keto diet. Again, it depends on the type of tumor and does it have those enzymes, or also on the immunity of the patient, on his mood, on his belief in his healing. But I'm sure that is not placebo at all. That's why. Dear friends, that's all for today. In the next video, we will talk about, I think about succinate, the video, how can it be used in cancer, for example. I will tell you my thoughts about it, and based on what we already saw today and in previous videos, I will tell you my opinion on this. And also we will talk about glutamine again, because somebody in comments asked me about glutamine. How can we block glutamine without having this drug DON? And it's really a problem, but I found several articles on natural products that can help with glutamine. That's why I will also do such a review for you. And don't forget to work with immunity. For example, medicinal mushrooms is a very interesting topic. Please watch the playlist. I have the video on mushrooms against tumors, mushrooms against brain tumors also. That's why please subscribe and don't lose this channel. If you want to support channel, please find the link down below in the description. And I would be happy if you write any comment. Good comment, maybe bad comment. If you are a hater, it's okay. I wish you good luck, to have a lot of strength to struggle if it's needed. Believe and be healthy. See you in the next videos. Goodbye.